we do on Tuesdays and Thursdays. And today's conversation is one, like I said a few moments ago, I have been avoiding for a very long time. But it is here, and I guess I have to do it. Oh my goodness. Anyway, so our conversation starter this morning is going to be about healthcare, right? Yes, health care. Yes. You know, that thing that a lot of us in Nigeria have been complaining about for a while now. Oh, it's so bad these days. This is not how we were meant to be, you know. You can go to the hospital, things are not doing the doctors are not doing their things right, you know. Quality is down. But of all the aspects, right, of healthcare this morning, ladies and gentlemen, I would like to talk about nurses and nursing. And now, the minute those words just came out of my mouth, I feel like I have to put this caveat. If you are a nurse, if you're a nursing student, please, this is not an attack on you personally, but it's more or less a vox pop to find out from people if things have changed since the last time I recall we having this conversation, which is about 2 years ago. You see, there were complaints from some, individuals around, the tertiary institutions talking about healthcare facilities across Nigeria. And so one of the underlying, complaints back then was that, the nurses they're not nice. They're very rude, very insensitive, blah, 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 blah. Now, I know that it was an overgeneralization because obviously I've been to hospitals, I've been to, primary healthcare centers and also the tertiary ones. I've also been to some clinics, private clinics and things like that. And there's a very vast difference with what I would hear and sometimes see, let's be honest, in some of the public spaces, and then I was seeing in the private spaces. One of the nicest hospitals I ever visited was in Abuja. What's the name? Cedar something. The nurses were absolutely amazing. You would think they are trying to nurse the patient back to health so they can marry them. That's the vibe I got. But it's not so much with the recent cases I've been hearing and sadly seeing. Now, of all the things that some Nigerians have commented on and complained about, talking about the care from nurses, is the judgment that they seem to face whenever they get to talk to nurses, not doctors now, nurses. So you go into the hospital, you want to have your vitals checked, like the procedure here, you go to one room, the nurses come, they check your blood pressure, maybe take blood samples or whatnot, and yada yada yada. They may ask you some questions, and then it seems as though when they ask you these questions or when you volunteer some information, there is a barrage of criticism and judgment. For example, a friend of mine recently went to one of the hospitals. This was in August, September. And then she said, hey, look, I'm not feeling well. I'm having temperature, this. And then, please, let me run some tests. So she said, okay, fine. They just go do this test. So when she got there, nurse says, okay, we're taking your blood. So, madam, what's your complaint? I thought you're very sick, doctor. It's okay. And she said, okay, your temperature. Are you sure you're not pregnant? And the girl goes, no, I'm not. Guess the nurse's response. Why are you not pregnant? You don't pass the age. She now opens the file. Hey, now, you don't pass the age you're born now. Why you never born? And for the next 5-10 minutes, this nurse was giving her a litany of reasons and prayers and blessings, all of which were unsolicited. So, join me this morning for a very difficult conversation. It's a very simple question I've asked this morning. Very simple. Ladies and gentlemen, if you've ever visited the clinic in the past 3 weeks, 1 month, 6 months, tell me, you and I are having a conversation alone, nobody's listening. Tell me the quality of care given to you by the nurses. That's all I want to find out.
The views and opinions shared on this program do not represent the position of Nigeriainfo FM. Nigeriainfo, let's talk.
08179230002, 08179230007. At Nigeria Info PH is where you find us on Facebook and on X. At Nigeria Info PH is where you find us on Facebook and on X. All right, WhatsApp and Telegram is 08090306416. 08090306416. Oh, Muriel, we just have a minute. Muriel, all right, quickly, Muriel.
Hi, Jude. Good morning.
Very quickly, please. Good morning.
Thank you. Well, Jude, I think the attitude of that particular nurse, obviously you said it cannot be generalized to all nurses. But I think the government hospital nurses in the public sector, I think they are quite different, from those in the private hospitals. Those in the public and hospitals, most times they are overwhelmed. Just Jude, they are. I do business with them too. Most times they are overwhelmed. And compared to, their remunerations and most times, Jude, they are grossly overwhelmed. Trust me. And I think a proper orientation should be done, in fact, on a study. And that's why in government hospitals there are platforms, they set up something like a Cadicom.
You are tuned in to
Nigeriainfo.
Muriel from Okrika. We had to take that a quick break, but we are back, and we'll go to our message folders talking about WhatsApp. WhatsApp is 0809-030-6416, 0809-030-6416. Facebook.com/NigeriaInfoPH, Facebook.com/NigeriaInfoPH is where you'll find us on Facebook and on X. Once again, Facebook.com/NigeriaInfoPH is where you find us on Facebook. You can also use that same handle at NigeriaInfoPH on X, all right, at NigeriaInfo. Care. Now, in the past decade, we've seen a very strong, very evident, and very well documented push migration from this country to the EU, in particular the United Kingdom. That is of medical personnel, doctors, in fact the entire medical team, doctors, nurses, lab scientists, radiographers, physiotherapists. All of these individuals are in high demand in the West. The question is, for those of us who are still here, how would you rate the quality of care you received recently? I said 2 years ago when we last had this conversation, I wasn't comfortable with it because I felt there was an overgeneralization. However, a good number of you called in and said, oh no, dude, it's not true. There are some. And I said, yes, not everybody's going to be the perfect model of representation. But the general perceptions that, oh, Nigerian nurses, they're wicked, though, they smile. Particularly those who they call Metron, they're wicked, where? I'd like to believe that perception has changed. However, following the comments and some of the reports I've received in the past few months, I am obliged to ask this question yet again. We'll go to the phone lines as we have Zion in GRA standing by. Good morning to you, Zion.
Yeah, good morning to you and compliment of the season.
I wish you the same. Good morning.
Sorry, before I continue the discourse, why are you people not giving us the Christmas carols?
Oh, don't worry, we're coming up with that. I mentioned that a few moments ago before I started. Don't worry, you get to hear more very shortly.
So there is a deficit to that.
We'll get to hear more. You get to hear more very soon.
On a lighter note now. Well, the attitude and service provided by the healthcare is not even based on. You cannot compare the services that the one from the government hospital provide, the one from the military hospitals provide, and the ones from the private sector, and even among the private sectors is being categorized, which means some are educated enough to know that they are dealing with human beings. Some of them are not trained. I'm telling you the truth.
If they're not trained, they will not be nurses in the first case. So they've had some form of formal training. So what exactly is the reason for the disparity?
Administration is not about carry guns, carry knives, and chase people. Public administration is a perception in our academical studies that helps you to relate and administer services to the public. That's a simple definition. Have you seen how these nurses abuse their patients? Have you seen where even doctors demean their patients as if they're not human beings? Have you seen where even a patient that needed all the help, the reason why they are there, or the reason why the name was changed from the original name to the patient? You see how they treat them there in most of the facilities? For the benefit of this, I would say let's give a thumbs up to the military hospital.
Okay, the military hospital here at Port Harcourt.
Yes. And also the naval Navy Medical Center, the one in Burukri. These guys are professional. Honestly speaking, look at the names I mentioned. Military. What about the government hospitals? The PNH and the UPTH and the rest of them. Have you seen now the patients? Go here. They have to go here. How can somebody to go here? Where is the person going to? Why can't you send someone to direct this person? Please take this person to the ICU. Take this person to the ENT. Take this person to emergency. Why don't you do that? Public administration, which is also applicable to everything we do, as long as there are two persons involved in where we sit or where we do business. So for the mental aspect of service provision, I think they need to upgrade by improving the way they do things with the people around them. Better. Thank you very much.
All right, thank you very much. So there's a difference, despite disparity, occurs between private hospitals. That there are some, obviously, maybe there are more, but Zion says the military hospital seems to be the one leading the pack in terms of quality care from nurses. That he thinks that they're pretty good. Do you agree? How many of you have recently received care from the military hospital here in Port Harcourt? And if you haven't, please do tell us of your. I think these are the kind of conversations that the Commissioner for Health, and also the NMA, right? MDCAN and the likes should be paying attention to. But anyway, what do I know? 017-923-0002. 017-923-0003. WhatsApp is 0809-030-6416. 0809-030-6416. We're talking about the quality of nursing care, in particular nursing care. The nurses that interact with you. How would you rate the care you received in recent time? Bob is on the line from Mbiama. Bob, good morning to you.
Jude.
Good morning.
Good morning. Good topic you brought here this morning. I believe everybody at one point in time has visited hospital. As far as you are eating.
Bob, sorry to interject. Could you please turn off your radio set or step away from the radio, please?
I've done so.
Thank you, please.
I've done so. I said everybody at one point in time has been to hospital for care, either private or public. I want to say this. If you don't have love, humanity in your heart, don't go to that session. I am telling you. There are hospitals I have vowed never to go. I'm telling you the truth. People can testify to it. Some people are in that business, they're in that job for business, just to make money. Not that they have love. The generation of nurses we have now, not the one of have. It's not like the one we have in ancient times or some decades ago. The young ones we have now, I'm telling you, doctors and nurses, many of them are just making money. Imagine when they would take the original drugs that were brought, allegedly, let me just say so, and take to their own pharmacy, private pharmacy, so that they can refer you there to go and do tests or to go and do one thing or another in their own establishment they have outside. When you call a doctor, a nurse, have you heard a language that, no worry me, no worry me, no worry me, no you make you sick or I'm not the one that make you pregnant too.
Really?
I'm not come and push those kind of language. I'm not am I the one that gets you pregnant? Madam, I beg, no worry me. Say you sleep. And all kind of language. Before it's not so. Before it's, oh, sorry, how are you? Oh, sorry, you get better, eh? That touching hand is very powerful. That's why even the Bible says when you lay hands upon his feet and recover. When your heart is loved, you touch somebody, your hand can administer healing. With comforting words, comforting, soothing words. Oh, you'll be okay, eh? Okay, don't worry, you'll be okay. The first thing is, how much has he paid? How much has he deposited? I've been in a hospital where if you don't deposit money, you will die. I'm telling you. They can't even give you paracetamol until that you have deposited money. That's the first question. Even in casualty, they comes to the casualty, people are accident in the casualty, they will not rush the person to make the person revive first. They will say, where are the parents? Where are the who brought them? If there's nobody that can stand the person in the casualty, we bleed to death or will die. I'm telling you. Especially government hospitals. It's a short. They are turned to something else. The nurses there, some of them there are worse than police on the road. I'm telling you the truth by experience.
That's a very strong allegation. Ikechi's in the car. We have Robin in the chair. Ikechi, good morning to you.
Mr. Jude.
Good morning.
Can you hear me?
Yes, we can hear you, but a little volume would be of help to us.
Oh, I think the network is bad.
Okay, but I can hear you. Can you hear me clearly, though?
Yeah, I can hear you.
Okay, let's go. We have Robin in the chair, but let's hear from you, please.
A few points. The reason why the health related to the hospitals, if you look at the public hospitals and the private hospitals, it's all about just better services in respect to care. So, sincerely speaking, I would never try a public hospital. Public hospitals are underfunded. But if you go to the private hospital, you can't compare a private hospital that is being equipped with a government hospital that hasn't been taking care of in years. And the reason I would say why the military hospitals are outperforming in the private sector is because of the funding the military receives.
Okay.
Yes, it's all about funding. Just like education. The reason private universities are doing that is because they are funded well and they equip good, they have good hands. The same thing with the public and private hospitals. The care I received in the private hospital, although I'm not a regular hospital visitor, is better than the care that you receive in the public
place.
Because I'm sorry to say, they feel like the best sentence. The way they handle. I went to one the other day. They were using smartphone like 3 different types because they don't have light.
At the public hospital? At the government hospital?
Yes,
okay. All right, Ikechi, thank you very much. Robin is on the line from Eche. John is on the line from Ada George. Robin, the mic is yours.
Yes. Good morning, Jude.
Good morning, please.
You see, this discourse is not a discussion that we have to, or any other person that matter should sugarcoat. Hospital as an institution, for me, and I'm sure for some other Nigerians, is a place where I wish I should never visit for any reason. But having said so, it's not possible. There is no adult in Nigeria who has not visited hospital either as a patient or going to see a loved one, either a father or a dad, sister or brother or friend. And the experience are there, glaring to us all, that the characters of these people who work there, they seem not to change at all. It's like a natural character of a chameleon must adapt wherever she finds herself. But I think we shouldn't leave at that. There's a body that controls the nurse. They have a union association. There's a body, an MA, doctors. They should organize frequent seminars as to furnish and educate themselves on the modern way to behave as is done all over the world. If you listen to Zion analysis, the hospitals he mentioned that the characters are different are regimented areas. Of course, we know in the military, they are regimented. So the character discipline is quite different from what we have in the public space. So it behoves on them, the nurses, the doctors, and those who work and apply their trade within that medical circle to change their pattern. Else, majority of Nigerians will still continue to take them for who they are because they have no respect for you.
Wow, strong words, John. You know, speaking to us about that, John. Good morning to you.
Yeah, good morning, Joe.
John, good morning. This is a very heavy conversation.
But in as much as we have bad eggs, we also have good ones.
Yes.
You just carry our next make them dissect them. But it's good. I visited a hospital in Port Harcourt where I took my friend to. She was treated they didn't ask for card money. They treat her, and it was the day she was discharged. They give us. I was going for one day. I said, let me know how much they say life is very important.
Wow, that's what they told you.
Yes. Once they finished that treatment, they gave me the deal. And I was very happy with the that was rendered that hospital. Fantastic place. I don't want to start mentioning it. It's a very nice place. I do go to see. But however, we still have nurses in public hospitals that have that human capacity that can also encourage people to come out of the sickness. I don't think any nurse is very happy seeing you feeling bad or feeling pain. I don't think that all of them cannot be that wicked. They can be complacent in terms of every delivery or whatever.
Okay.
But most times it's an institutional problem. It's not just about them. Because when the doctors and the government are not doing what they're supposed to do, they transfer the aggression to patients. But we still have good notice about this.
Oh, John, thank you very much. I'm pleased to hear that you enjoyed the services, the care rather that you were opportune to have your son or your daughter experience. So, like I said, it's a good story to get to share. That overgeneralization that Nigerian nurses are bad, Rivers nurses are bad. It's not doing a good service. However, we cannot ignore the very many complaints over the years. Good morning, Jude. My name is Emmanuel from Iwofe. In Rivers State, the best nursing care is usually from private hospitals because they are being paid well and they don't attend to many patients compared to the government hospitals. The military hospital in Rivers State, nurses are kind, always, and they are willing to help. It's almost like a private hospital. For the government, after I've been to a BMH and UPTH, BMH has better nurses. UPTH nurses are always angry, rude, and tired. The management of that hospital should really look into addressing it. Thank you, Emmanuel. Kurt, on the line from Uniport. Court, good morning to you.
Good morning.
Welcome, please.
Jude, I discovered that in that private hospital, if human beings are working there, it's not angel from heaven.
True.
And yes, and the owner of those private hospitals, they are not working from heaven. They are working from public hospital also. Some of them are the management of some department in that public hospital we are talking about. So my question, why are they not putting the effort they put in their private hospital to work in also public hospital? Because if they do so, the hospital will still work efficiently the way we are commenting their own. I have one experience. My brother wants to have a surgery, his knee. We work from all the public hospital. They say they cannot do it until a friend came at the private hospital.
Okay.
So my greatest surprise, the same person who's supposed to do it in that public hospital is the person that carried the operation in that private hospital. So I say, why could not do it there? He says he's a specialist, that he will not have time to be going that government hospital every day, that this operation needs monitoring. Are you seeing the problem? Not that they cannot do it in public hospital, but now they decide to here, even charge you higher. He told me that they cannot make chance of going to public hospital every day to monitor this person for the person to get well. So I believe that when they put the effort they are putting in their own that private government hospital, it also work well. So they should try and do the right thing. Thank you.
All right, thank you very much. You see, I don't want to speak for doctors. I can't speak for doctors. But having spent a lot of time with them, I do understand some of the nuances that some people may not. So a consultant, as the name implies, is somebody who, quote unquote, is called to attend to specific challenges from anywhere. You could be here, somebody call you, okay, Jude, there's a patient that has plantain in his throat. Come and remove it. I'm like, okay, I have to move. And that particular type of surgery, maybe it's very detailed. Because I'm meant to be moving around, if the person does it in that hospital, let's say it's in the private hospital, there may not be enough hands as skilled as mine to pay attention to that person. But anyway, once again, no holding brief or trying to justify actions. Obviously, there are loopholes within the system that really needs to be checkmated. WhatsApp 009-030-6416. 009-030-6416. My brother, what most scholars are telling you is nothing but the truth. In BMH, when my wife delivered our children, come and see how the nurses having any slight chance will come and obtain our drugs and sell it out. But we still have good ones. My name is Pere from Port Harcourt, Rukpoko. The private hospitals definitely treat their patients better. Well, sometimes they even take the service a bit over the edge. I had a sexual experience with two nurses in the same hospital at the same visit at the same time. I can't mention the name of the hospital, but it was here in River State. Aside that, the private hospital is more reliable in terms of service. Pere. What in good God's name did you get yourself into? All right. Good morning, Jude. The attitude of many medical practitioners in Nigeria, River State to be precise, is horrible. They are not there. They're not there to render services, but to get paid. They treat patients with disrespect, lack of care, arrogance, etc. So BMH is one of those places. They are so careless that their test results are not reliable. I'm saying this from a personal experience. Interesting. They lost the original samples such as blood, urine, etc. Then they put pressure to produce reports. They manufacture anything they like and give patients test results. Sometimes they condition the patient to repeat one test over and over. The Nigerian government hospitals are horrible. Roberto in Port Harcourt. These are very strong allegations. We'll be back after this break.
The show continues after this break.